6 minutes past 9 in Madagascar, a severe combination of drought, cyclones and malaria has resulted in an 87% surge in child malnutrition cases in the Ikongo district. A new report from Doctors Without Borders highlights that over 550,000 children are at risk, prompting urgent calls for action. To speak to us about this crisis is Claire Waterhouse, Director of Advocacy and Analysis for MSF Southern Africa. Very good evening to you, and thank you so much for speaking to us, Claire.
Hi, thanks so much for having us.
Paint a picture for us about what is going on at the moment, and just how long has this been prevalent?
So it's historically been an issue for many years in Madagascar, but since late last October, we've seen numbers really picking up. And what we find ourselves in now is a convergence of a few key critical factors that are really seriously exacerbating the situation. So right now we are in the lean season, which is the period, when the last harvest food stocks are running low, but the next harvest hasn't started yet. So already a difficult time nutritionally. But it is also cyclone season, and there is a peak in malaria at the moment. We're seeing incredibly high numbers of malaria cases, particularly among children. And that is, as a combination, spells disaster in a nutritional sense. And, Madagascar has long struggled with food insecurity, with difficulties accessing healthcare, etc. So we are extremely worried about it, particularly in the Ikongo district where we are working on this.
Perhaps let's just start by tearing apart all three elements that you've noted and just look very closely at the figures and what the impact has been. Let's start with the cyclones. We know that was, I think, several weeks ago, that was a cyclone that made landfall in Mozambique as well, and we had told that the impact in Madagascar was quite bad. So can you just take us through what happened then and where we are now post-cyclone?
Yeah, so unfortunately, Madagascar is quite regularly hit by cyclones. It's an extremely vulnerable place in terms of climate change and these kinds of extreme weather events. So as with the most recent one, but in general, these kinds of extreme weather events, then they disrupt health services. Maybe they cause floods in clinics, or they destroy clinics because of high winds, etc. They make the road conditions more difficult for communities to be able to access clinics. And then that in turn weakens communities' sort of long-term nutrition resilience. It can also destroy food stocks or crops as well, all of which add to these issues significantly. So that is, in terms of cyclone season, why it is really disastrous for this kind of thing.
And because of the cyclone, that would relate to the flooding conditions that the country would have experienced.
Yes, absolutely. And that, already, that all of it impacts an already not great situation to begin with. So these communities already have chronic food insecurity. They have quite limited food diversity. As you know, Madagascar is an island. It's not extremely wealthy, making it difficult to get different kinds of food into the community. And then these recurrent climate shocks, alongside seasonal diseases like malaria, then are really spelling disaster. So with malaria, what we're seeing in this peak as well is from January to the middle of February, so the middle of last month, we had already seen more than 11,000 cases of malaria being reported. And that makes Ikongo one of the hardest hit areas in the country. In our supported facilities there, we now see that malaria is the leading cause of consultations that we have. And there's a positivity rate of over 50%, which is huge. And that, of course, especially impacts children. Children are very vulnerable to this. And if they are already nutritionally vulnerable or facing malnutrition, then they are even weaker in the face of a disease like malaria.
And what are the complications just in terms of treatment of malnourished children, particularly in the Grand Sud?
So it's I mean anything you can imagine. Unfortunately, at this point, we find it difficult for people to access healthcare. You know, the clinics tend to be geographically isolated, very bad road conditions, and then that in turn means that there's delays in accessing treatment, which means by the time children with acute malnutrition get to us, they are really late for care and sometimes in a critical condition, which makes it much harder for us to be able to treat them. It's also then more difficult for us to get supplies to clinics and that kind of thing, which then also adds to the complications of treating them. Because the thing with treating malnutrition is you would imagine, you know, a starving child, an acutely malnourished child comes in and you just pump them full of food and they're good to go. But it's really much more clinically complicated than that. It has to be quite slow and steady with a very careful balance of what nutrients and how much they're getting, because you can also very quickly overfeed or shock their system with too much food. So it's a real process, which makes it also complex when families might miss appointments because of weather situation or because of lack of access or those kinds of things. So we have been really working hard since October to scale up our activities, working with local authorities. But at this stage, we are extremely worried, and so is the Malagasy government, that it's not enough and we are heading towards a disaster.
I mentioned the current scale of the crisis is an increase of over 80%. That's quite alarming. So what hope is there? And I'm just looking at the funding gap of 125 million US dollars that's being reported for the National Humanitarian Response Plan. Just how much more difficult does that make your work, for instance, as MSF?
It makes it very difficult because there are not many other actors in Madagascar, and those who are there are struggling. You know, as we know, humanitarian aid and humanitarian funding has been decimated over the last year. So there are less and less partners, and it becomes very difficult to work at the scale that we need to, because MSF can never respond or replace, rather, you know, the work of so many other partners. We are just one organization and we are doing our best, but it's really difficult. So if we look, you mentioned 125 million, which is correct. But if we look specifically, for example, at the World Food Program, they need a minimum at the moment of 18 million US dollars to cover food security just for the next 6 months. And that is a huge number, but it is critical because, you know, essential items, essential commodities are not getting to the communities that need them, and there is very little care for pregnant and breastfeeding women in these rural areas, these remote areas, and very few organizations in place to respond. As a result, the Malagasy government as well is having trouble meeting these needs, and the funding gap essentially is crippling the response of everyone to this. And it is particularly important to deal with pregnant and breastfeeding women because that's where these crises start. You know, if women are malnourished and not getting enough nutrients while pregnant, that already brings baby out underweight, facing already severe vulnerabilities. If they are not able to breastfeed sufficiently because of lack of nutrition, that then deprives children of urgently needed nutrients, and it does lead mothers to make very difficult choices, you know, about having to start their babies on solids at very early ages, as young as 2 or 3 months, because they're not producing enough milk, and formula is not readily available and is just far too expensive for the average person. And as we know, little babies' stomachs are not designed for solids. You know, they're not designed for real food. They get everything they need from breast milk. But of course, these mothers are absolutely in a terrible situation, absolutely desperate, trying to look after their children. And by the time they get to us, often it is an extremely severe situation that needs to be addressed urgently.
And is there record keeping, and I'm talking about credible record keeping by the Malagasy Ministry of Public Health, particularly on maternal, newborn, and child mortality rates as a result of the crisis that you're facing? Because you also say, despite the WFP, that's said, 18 million US dollars in funding shortage, but there's also a lack of partners. You also mentioned the difficulty that the government has in partnering.
Yeah, absolutely. It's very difficult to find partnerships, and I think the government, the Malagasy government, is doing their best. They've put out this alert with the United Nations to say we are in trouble. Please, it's a huge funding appeal to deal with their humanitarian situation, and everything that we are seeing in Ikongo confirms what we are hearing from the Malagasy government as well. So we are seeing it in person as well, and it's a terrible perfect storm of things. I mean, we've screened 27,000, just over 27,000 children since last October, and 4,000 of them have been treated for acute malnutrition. That's actually a very high rate. And then 800, so 842 actually, almost 1,000 children, probably 1,000 very soon, have had severe acute malnutrition. And that's really at its worst. That's where really we're talking life or death.
And that's where I'm wondering what are the numbers? What is the data on whether this has resulted in deaths? Because given the extent of the socio-political instability as well, it is highly likely that the government is going to be very transparent about what is happening on the ground, the failures, the systemic failures that we're seeing.
Yeah, absolutely. There have undoubtedly been deaths at this stage, and that is our concern, is that it will only get worse. The next few weeks are going to be critical for whether we can turn this around from many, many deaths of children, or whether we are able to see partners stepping in, funding coming up, working, urgently at a national level to mobilize, to support health facilities, to make sure that there's a continuity of supplies, of nutritional supplies, but also anti-malarial medicines, making sure that access to healthcare is freely available for people in the most isolated areas. Unless we address that urgently, and we need to do that in collaboration with the Malagasy Department of Public Health, in collaboration with other partners, we are looking at really a catastrophe for children who, as we know, are always the most disproportionately affected, but also the most innocent in these kinds of crises.
Is there still such a thing as a free healthcare in the current environment?
It's a tricky situation, I would say. All of the services that we provide as MSF are free, and we are continuing to work with all the partners and the government to make sure that where people need to access this kind of urgent care, it is always free. But even free care is not that helpful when you can't access the care, or when it doesn't have what is needed in stock. So it's great if it's free, but if there's no nutritional supplements there for children who have malnutrition, then that won't help. And that's the kind of shortages we're seeing at the moment.
So what are you saying to the international community about helping you in prevention, scaling what is needed now, what can be in the medium to long term to strengthen your capacity?
Well, what we're urgently saying is governments need to step up, international organizations need to step up. The UN has put out this call, their members need to urgently step up. And we are well aware that this is a world in crisis moment at the moment. There's just so much going on, and there's a lot more visible crises. But what we are seeing is these more silent crises, these more hidden crises that people are not aware of, that could be more easily solved if a few governments or organizations were able to step up and step in and provide the funding that is needed, help with that mobilization to get things urgently sorted out. So we're really urgently asking that any country who is able to step in on this, that they do so, and they do so urgently. We don't have time to wait for bureaucracy and paperwork. We need to get moving now for these children. And for just average people who are listening to your channel right now, please talk about this, share this. The lives of Malagasy children are worth no less than lives in Sudan or in Gaza or in Iran or anywhere else at the moment. And there is stuff that we can do about this. So we need to do it, and let's come together and do that.
And Claire, do please let us know how else we can help your cause. Thank you so much for speaking to us, and we will continue sounding the alarm. Claire Waterhouse is the Director of Advocacy and Analysis for MSF Southern Africa, speaking about the dire situation in Madagascar, just in terms of child nutrition. They say that has gone up in terms of the acute nature of it by 82%. Brings the time to 21 minutes past 9 just about.